YouTube, welcome to Dr. Vibes, a learning point. In this video, we'll study details about renal cell carcinoma. First, let's begin with epidemiology. 2 to 3% of the adult malignancies are the renal cell carcinoma, and it is more common in males than in females. There are two types, sporadic cases and familial cases, and sporadic cases are more common than the familial cases. Now, let's see what are the risk factors for RCC. That is given by the mnemonic HOT. H is for hypertension, T is for tobacco exposure. I have not mentioned here smoking because tobacco exposure is itself very high to cause RCC. So you may not be smoking, but if you are under continuous exposure to tobacco, you may be at a risk factor. And O is obesity. So HOT, hypertension, obesity, and tobacco exposure. What are the subtypes? Basically, the pathological subtypes. You have clear cell, papillary cell, clear papillary cell, chromophobe type, medullary cell type. Let's do the clinical presentation. So most of them are asymptomatic. If symptomatic, there is a classical too late triad. Why too late? Because RCC may be present very early, but the triad will be presenting very late. So the too late triad will be that there is a mass in the lumbar region, there is flank pain, and there is hematuria. Okay. After this, there can be IVC obstruction. Now, if there is obstruction on the left side, that will cause renal vein thrombosis, and on the right side, it can cause IVC obstruction. And both of them will ultimately lead to varicocele. Now, this varicocele, you must remember that it is non-reducible. Okay. Obviously, there can be symptoms of distant metastasis as well because this is carcinoma. So, distant metastasis to ho hi sakta hai. If it goes to your respiratory system, it can cause cough, hemoptysis. If it can go to your bones, it will cause bone pain, especially lower back pain is seen. Obviously, weight loss and anorexia is always associated with carcinoma, and there can be constitutional symptoms as well. Now, it can also go to the liver and cause hepatic dysfunction. Most important thing under symptoms that you have to know about in RCC is the paraneoplastic syndrome. So what is paraneoplastic syndrome? It is basically that if there is a tumor in the body, then that tumor will produce certain substances in response to the tumor, or the normal tissues in the body will produce certain substances in response to the tumor. So basically this is an immune reaction to the tumor that is present in our body. Okay. So hypercalcemia can be seen as a paraneoplastic syndrome. Why hypercalcemia is seen? Because of the overproduction of 1,25 dihydrocholecalciferol, and they can, if the bone is involved in RCC, then the bone will undergo osteolysis, and this metastatic osteolytic bone involvement will cause increase of calcium in urine and blood. Then there is hypertension. Why there is hypertension? Suppose there is a tumor in the renal system, which is a renin producing tumor. Now what will renin do? Renin will activate the RAS, and that will increase the blood pressure. There can be AV fistula within the tumor. There can be arterial compression. Suppose this tumor is so big in size that it compresses the artery, and that will cause hypertension. You also get to see polycythemia. Why? Because of increased erythropoietin production. And why? One more thing why you can see hypertension is that there is increased intracranial pressure. Why? Because if there is CNS metastasis, then any tumor in the CNS can produce increased of intracranial pressure. Polycythemia, I've already told you, increased of erythropoietin will cause polycythemia. One important thing is the Stauffer syndrome. This is the hepatic dysfunction in case of RCC, and you must remember that this is non-metastatic. Non-metastasis. Normally what is happening is that metastasis is occurring to one organ, and that is why organ खराब हो रहा है. लेकिन यहाँ पे metastasis नहीं हो रहा है to the liver, but still it is going down. And also you have Cushing syndrome, in which there is increased production of ACTH hormone. How will you manage a case of RCC? Management includes diagnosis and treatment. So the diagnosis is, first of all, CECT is done, and this is the gold standard as well. This is the first line as well, and this is the gold standard as well. What do you find in CECT? Obviously, you will find a tumor in CECT. You will find the location of the tumor. You will find whether this tumor has gone to the nearby structures or not. Needless to say, you will also see the size of the tumor. You can also see the vascularity, and if there is any tumor, thrombosis. Is there any adrenal involvement? Because kidney के ऊपर क्या होता है? Adrenal gland होता है. Is there any adrenal involvement? And you can see perineal lymph nodes. Now, there can be signs of distant metastasis as well. For that, you have to do CCT thorax. तो respiratory system involvement है या नहीं, lungs, heart involvement है नहीं, पता चल जाएगा. Then you do a transesophageal echo. This is very important to note the cephalic extent of the IVC thrombus. IVC obstruction होता है ना because of IVC thrombus. उसका cephalic extent से पता चलेगा. And this is lastly the bone scan that is used for increased of alkaline phosphatase and bone pain if present. Now let's do the treatment. So basically you have a renal mass biopsy plus active surveillance. You have thermal ablation. You have partial nephrectomy and you have radical nephrectomy. Now, what does active surveillance mean? Active surveillance means the close monitoring of the tumor to decide what can be the further treatment options available. Now, you should know what are the indications of renal biopsy. This is a very commonly asked question. First, if it is a metastatic tumor, you can find the signs and symptoms of metastasis, and your investigation also shows that yes, there is metastasis present. Now, first is metastatic tumor. Second, in those patients whom non-surgical treatment is the plan of management. Okay, surgery is somewhere not possible or the patient has not given consent and you want to go for a medical treatment, आपको renal biopsy करना पड़ेगा. Third is old frail patients. Fourth, patients with life expectancy less than 5 years of age. And fifth, if it is a marginal renal mass present. These are the indications of renal biopsy. Or marginal renal function, I'm so sorry. मतलब renal function impaired हो गया है. Renal function impaired हो गया है, old frail patients है, non-surgical management is the plan of management, metastasis present है. In those patients where life expectancy is less than 5 years, मतलब इतना severe disease जा चुका है. And now one more thing, आपको जानना पड़ता है कि ये ट्रीटमेंट ऑप्शन आप कब कब करोगे. सो एक्टिव सर्वेलेंस तब करते हैं जब ट्यूमर का साइज लेस देन 2 मिलीमीटर होता है, 2 सेंटीमीटर होता है, सॉरी. अगर ट्यूमर का साइज लेस देन 3 सेंटीमीटर है, ठीक है, तो हम लोग क्या करेंगे, हम लोग थर्मल अब्लेशन करेंगे. एंड व्हाट आर द ऑप्शंस अवेलेबल? ऑप्शन इज क्रायो अब्लेशन, रेडियो फ्रीक्वेंसी अब्लेशन, एंड दिस इज डन आफ्टर रेनल बायोप्सी. ठीक है, तो 2 सेंटीमीटर से कम हुआ एक्टिव सर्वेलेंस करो, 3 सेंटीमीटर से कम हुआ थर्मल अब्लेशन करो. पार्शियल नेफ्रेक्टमी और रेडिकल नेफ्रेक्टमी कब करना है? पार्शियल नेफ्रेक्टमी इज डन in small tumors in those patients who have a functional solitary kidney. Okay, क्योंकि एक ही किडनी है तो ऑब्वियसली मैं पूरा तो किडनी को हटा नहीं सकती, उससे मेरे को पार्शियल नेफ्रेक्टमी करना होगा. एंड रेडिकल नेफ्रेक्टमी इज डन. और व्हाट हैपेंस इन रेडिकल नेफ्रेक्टमी? रेडिकल मतलब पूरा किडनी को हम हटा देते हैं, एंड साथ ही साथ इप्सिलैटरल एड्रिनल ग्लैंड को भी हटा देते हैं. ऑल्सो इफ देयर इज अ रीजनल लिम्फ नोड इन्वॉल्वमेंट और नहीं भी हो तो भी उसको हटा देते हैं. So this is done in very severe case of the disease. So pura kidney, adrenal gland, lymph nodes have been involved. And lastly, you can read about the systemic treatment in RCC.